I'm very pleased to have on this segment Dr. Peter Kaye, who's a gastroenterologist and partner in gastroenterology of the Rockies.
That's right.
Right, welcome to the program.
Thank you.
You know, our topic today is colonoscopy. Now, I imagine 10, 15 years ago, very few Americans even knew the word, but it certainly gained frequency. Why is that, and why is it important today that people know about it?
Well, I think we just have learned much more about colon cancer and where colon cancer comes from, et cetera. And we've kind of realized that really colon cancer is the most preventable cancer and a very common cancer. And with all that, I think that's where the recognition is where the understanding that colonoscopy saves lives and prevents colon cancer as a screening tool.
And it really sort of got the kick into the public consciousness with Kaye Couric and her husband, right?
You're right. Unfortunately, Kaye Couric's husband did die of colon cancer, and Kaye Couric, really started, a movement of awareness about colon cancer and that it is preventable in screening. In fact, they even sometimes call it the Couric effect because it really made a dramatic difference in screening. And the other thing that made a big difference is Medicare covering colonoscopies, and then insurance companies following Medicare and covering colonoscopies. Again, with a realization that colon cancer, it's the second leading cancer in women, it's the third leading cancer in men, it's the second most lethal cancer. And knowing all that, and knowing that it's preventable, that's when all this kind of marched down the road. So you're absolutely right.
Well, why would it be more common in women than men?
I wouldn't say more common in women than men in general. In general, colon cancer and colon polyps, it's a 1-to-1 disease, meaning equal in men and women in terms of prevalence. It just may be the amount of prostate or lung cancer in men.
Right.
Obviously, breast cancer, #1 in women. But colon cancer is more prevalent than cervical cancer. It's more prevalent than ovarian cancer. And again, it's for the most part preventable.
Okay, preventable. Now, is that because of the colonoscopy and what you discover? Or are there things, for example, diet or other interventions that can help you from getting cancer in the first place? Right.
Well, that too. We can talk about diet a little bit, but certainly colonoscopy and what colonoscopy can do. Meaning, we kind of know where colon cancer comes from. We're all born with a normal colon, and then what happens is some people can develop a polyp. So you can develop this solid growth off the wall of the colon, which then eventually can turn into a colon cancer. Well, that whole sequence from normal to the polyp to the cancer takes about 10 years. So it's a very long sequence, so you can do something to intervene and break that cycle. Meaning if you go in and you find a polyp and remove it, take that out, you go back to normal, and essentially that prevents colon cancer.
Right.
And so that's where the prevention part of colonoscopy comes in, and colonoscopy is the only test really where you can do one-stop shopping and remove the polyp as well as diagnose it. But then also colon cancer is one of those things, if you find it early, it's almost 90% curable. If you find it not early, it can be in about 33% of people fatal. So that's the other reason that early detection saves lives.
And why is 50 sort of the demarcation age for getting colonoscopy?
We don't want to pick on 50-year-olds, but
well, that's the title of our program, 50 Up. So
the reason being is that at 50 and above, that's when you start to have a higher chance of having a precancerous colon polyp, about 25% chance, so 1 out of 4 chance. The other thing too is in terms of colon cancer, about 90% of colon cancers occur at the age of 50 or above. So for those two reasons, because polyps are starting to be more prevalent, and the colon cancer issue, that's why sort of the national standard has been 50. And then if that's clean and you don't have a family history, et cetera, 10 years. Because again, it's very slow growing, normal to a polyp to a cancer.
Right. So you mentioned 10 years, doctor. If you had one colonoscopy at 50, would you recommend then the person wait another 10 years if there's no significant indication of
Yeah,
cancer?
that's a nice thing is you get a break for a
You
while.
keep on going until
You keep it going to a point. In general, the United States Preventative Services Task Force recommends at 85, certainly we generally stop doing screenings with colonoscopy. And between 75 and 85, it's more depending on how somebody's doing, et cetera.
Right. Now, I know I've been through colonoscopy, and it's not a pleasant preparation process. And so people, I think, have heard about the virtual colonoscopy.
Sure.
And thinking, oh my, will this prevent me having to go through all of the drill in preparation? What do you see as the advantage and disadvantage of the virtual colonoscopy?
Right. Well, unfortunately not. The problem with virtual colonoscopy also is you also have to prep. And you're right, the prep in general is maybe the worst part of the whole thing. Colonoscopy, for instance, is painless, fairly quick, safe, but you do have to clean out for it. However, the preps have gotten much, much better. Mm-hmm. So really they've come a long way with preps in terms of much lower volume, easier on the patient, et cetera. So that has improved. The trouble with virtual colonoscopy is, again, you have to prep, so you're not escaping that. Right. The other trouble with virtual colonoscopy is it's not quite as sensitive. So it can miss smaller polyps, it can miss flat polyps. The other trouble is it can't do anything with what they see. Right. So if they do see a polyp, or maybe they just see stool or something, they don't know what they're looking at, that means a separate prep, a separate day off of work where you have a real colonoscopy. So yeah, it can be a problem in that regard. Flip side, I agree with you. Any screening is better than no screening. Right, right. But the best screening is probably
We are running out of time. It's so interesting. If people want more information, how could they contact you and Gastroenterology of the Rockies?
Oh, thanks. Well, yeah, so we have offices here in Boulder and then also in Longmont, Lafayette, Broomfield, and Lakewood. So we have offices near where people hopefully want to be seen. And our office number is 303-604-5000. And then we have a website, which is www.gastrorockies.com.
Well, thank you so much. It's been very informative, and I'm glad I'm on the right track having my colonoscopy. And now we want to go out with an upbeat segment with Chrissy. Thank you very much, Doctor.